This is the second video for session 3.
When we have a rash or injury on our face, we're really careful to treat the inflamed area until it heals to prevent scarring. That said, many of us may be unaware of hidden low-grade inflammation in the hypothalamic area of our brain.
Inflammation in this area of the brain is a precursor for the development of metabolic and cognitive disorders, as well as autoimmune disorders such as Crohn's and rheumatoid arthritis. This hidden inflammation, which may result from unmanaged stress, targets cells specialized in energy metabolism leading to insulin resistance. If there's just a short period, 2 to 3 weeks, of consuming excess carbs in the diet, the effects of metabolic disturbance in the brain can be reversed. However, after a longer period, the neuroprotective mechanisms fail, resulting in inflammation. This inflammation leads to the production of cytokines and leads to deficiencies in insulin and leptin signaling. Reducing the intake of simple carbs, high fructose corn syrup, and inflammatory foods helps the brain detox and recover from inflammation and immune system dysregulation.
Low-grade chronic systemic inflammation caused by high levels of circulating cytokines is an emerging factor in crossover studies of depression, anxiety, metabolic weight-related disorders, and autoimmune disorders. This is because systemic inflammation-derived cytokines can cause a breach in the brain-blood barrier and allow for the entry of inflammatory cells into the brain.
Stress, anxiety, and depression are all associated with activation of our immune system. Activation of this system is helpful in terms of fighting off germs and viruses. However, if the immune system is constantly inflamed due to chronic stress, our anti-inflammatory response diminishes and leaves us vulnerable to continual infections and diseases. You may have heard the term cytokine storm in reference to life-threatening illnesses. A cytokine storm is a severe immune reaction in which the body releases too many cytokines into the blood too quickly. Cytokines play an important role in normal immune responses, but having a large amount of them released in the body all at once can be harmful. A cytokine storm can occur as a result of an infection, autoimmune condition, or other disease. It may also occur after treatment with some types of immunotherapy. Signs and symptoms include high fever, inflammation, redness and swelling, and severe fatigue and nausea. We can boost our antioxidant, anti-cancer, antiviral, and anti-aging reserves by including fruits and vegetables, high in resveratrol, quercetin, and curcumin to our meals.
We discussed the glycemic index in reference to restoring mental and metabolic health throughout this course. The glycemic index, GI, refers to the total increase of blood glucose after consuming a specific carbohydrate-containing food. Physicians developed the GI in 1981 for people with diabetes. It's a guide to food selection that helps us recognize and manage the GI content in foods. Consuming low GI foods helps prevent large increases in blood glucose, which is important for managing or avoiding the onset of type 2 diabetes. Glycemic variability measures the peaks and valleys in blood sugar levels in the time following the consumption of food. Blood sugar spikes associated with foods high in sugar, fructose, and high fructose corn syrup are a known risk factor for developing many clinical conditions, including diabetes and cardiovascular disease.
When we consume carbohydrates, our body breaks them down into glucose, a type of sugar that is used by every cell in our body for energy. As our body produces glucose, blood sugar levels rise. This stimulates the pancreas to make insulin, a hormone that helps our cells take in glucose from our bloodstream, lowering our blood sugar levels. If we frequently eat meals and snacks high in carbohydrates, elevated glucose levels require the pancreas to continuously release insulin, which can lead to a state of insulin resistance. Insulin resistance is a condition where insulin isn't working effectively to allow stored glucose to be used as an energy source.
Insulin resistance is the most probable single link between obesity, type 2 diabetes, cardiovascular disease, and our cognitive functioning. Different tissues, including those in the brain, can manifest insulin resistance. Insulin resistance negatively affects the functioning of the HPA and connections with the hippocampus. This in turn can lead to cognitive impairment as well as a reduced ability to moderate our stress responses and regulate appetite. Type 2 diabetes is a manifestation of insulin resistance at the level of the liver, a key factor to metabolic inflexibility. In this state, the pancreas is working overtime to produce insulin to try and keep blood sugar levels in a healthy range. If we don't change our style of eating, eventually the pancreas wears out. This suggests that we want to moderate the intake of foods containing glucose, sugar, fructose, and high fructose corn syrup. This is particularly true for those who want to avoid weight regain following successful bariatric and pharmaceutical interventions for weight loss.
Metabolic flexibility is a measure of the body's ability to respond or adapt to conditional changes in metabolic demand, insulin resistance, and the mechanisms that govern energy selection between glucose and fatty acids. Metabolic flexibility is the ability to use both fat and glucose for energy. When inflexibility is present, the body will use glucose, but not stored fat for energy, leading to weight gain. When we put on weight, fat not only gets stored around our body, but it also gets deposited in organs such as the liver, pancreas, heart, and other ectopic regions. Type 2 diabetes and metabolic-associated fatty liver disease are directly related or bidirectional. If we have one condition, it's likely the other will develop. Presently, it's estimated that 1 in 6 people with type 2 diabetes has undetected liver fibrosis, suggesting that liver function testing should be done during annual wellness checkups. Lastly, in the brain, insulin plays a direct role in how mitochondria respond to stress. A state of insulin resistance impairs the glucocorticoid stress response and inhibits mitochondrial biogenesis and cellular renewal.
A healthy liver is key to regulating blood sugar. To preserve liver health, it's important to pay attention to carbohydrates and the amount and types of sugar we consume. The small intestine is where carbohydrates are converted into their simplest form, glucose, fructose, and galactose, which are then absorbed into the bloodstream and transported to the liver for further processing. The primary biologic function of glucose is to provide an immediate source of energy, whereas the primary function of fructose is to aid in the storage of energy as fat. Glucose and fructose are metabolized very differently by the body. While every cell in the body can use glucose, the liver is the only organ that can metabolize fructose in significant amounts. The liver uses fructose to create fat in a process called lipogenesis. When there is too much fructose, tiny fat droplets begin to accumulate in liver cells, leading to the development of metabolic-associated fatty liver disease, as well as increasing the risk for developing pancreatitis. Just for clarification, fructose is a simple sugar that is the primary nutrient in fruit and honey. However, in the Western diet, its main source is table sugar, sucrose, which consists of fructose and glucose bound together, and high fructose corn syrup, which consists of a blended mixture of fructose and glucose. When we consume products artificially high in fructose, we tend to overeat since these foods produce minimal increases in plasma insulin levels that don't trigger insulin release, or the release of hormones like leptin that tell us we're full. Excessive consumption of products containing high fructose corn syrup is thought to be a leading cause of metabolic fatty liver disease. Because most fruits contain phytochemicals that counteract inflammation, we're encouraged to include a variety of seasonally available fruits as part of an overall approach to wellness. For those concerned about fructose overconsumption, the glycemic index provides the best guidance for determining fructose values of various fruits and berries. Lastly, the importance of eating whole fruit over drinking juice is that the fiber in most fruits slows down the rate at which sugars are digested, reducing the effect on blood sugar levels.
Along with excessive consumption of unhealthy fats, diets high in sugar cause the liver to create more LDL while lowering levels of HDL. When we have too much LDL, plaque can build up, causing the wall of blood vessels to thicken. This narrows the channel within the artery, reducing blood flow, as well as the amount of oxygen and other nutrients reaching the body. Where plaque develops and the type of artery affected varies with each person. Plaque may partially or totally block blood flow through large or medium-sized arteries anywhere in the body, including in the heart, brain, pelvis, legs, arms, or kidneys. This can lead to conditions such as coronary heart disease, angina, and chronic kidney disease. So, what can we do? If possible, we can increase our physical activity levels and work with a nutritionist specialized in lifestyle medicine to learn how we can restore liver health and insulin functioning. 3 types of foods to avoid are those high in unhealthy fats, added sugars, and refined carbohydrates. When shopping, if the food is packaged in a box or shiny foil bag, we should probably be looking at the ingredients.
Muscle movement is key to metabolic recovery and the prevention of type 2 diabetes. We don't spend much time thinking about all the interconnectivity between our brain and body, but our brains and muscles are in constant conversation with each other, sending electrochemical signals back and forth.
It's a fact that to sustain brain health, we have to keep our muscles moving, and this is even more important as we age to avoid the onset of sarcopenia. Sarcopenia is the progressive loss of muscle, mass, strength, and function that is often related to sedentary lifestyles and metabolic diseases such as type 2 diabetes. Exercise can improve mitochondrial biogenesis, the creation of new cells and mitophagy, the flushing of dead or old cells, both in the brain and our muscles. Skeletal muscle is the type of muscle that allows us to move our body around, and it's one of the biggest organs in the human body. This muscle is also an endocrine tissue, which means it releases signaling molecules that travel to other parts of our body to tell them to do things. The protein molecules that transmit messages from the skeletal muscle to other tissues, including the brain, are called myokines.
Myokines are released into the bloodstream when our muscles contract, create new cells, or perform other metabolic activities. When they arrive at the brain, they regulate physiological and metabolic responses there too. As a result, myokines have the ability to affect cognition, mood, and emotional behavior. Exercise stimulates what scientists call muscle-brain crosstalk, and these myokine messengers help determine specific beneficial responses in the brain. These can include the formation of new neurons and increased synaptic plasticity, both of which boost learning and memory. In these ways, strong muscles are essential to healthy brain function.
Even moderate exercise can increase metabolism in brain regions important for learning and memory in older adults. The brain responds to exercise in strikingly physical ways. The hippocampus, which we know plays a major role in learning and memory, shrinks in late adulthood, increasing our risk for developing dementia. However, exercise has been shown to increase the size of the hippocampus even late in life, improving memory, processing speed, executive function, and spatial memory.
Regular exercise is a proven prevention and treatment strategy for individuals with prediabetes and type 2 diabetes. A consistent regimen of resistance training, RT, and endurance training, ET, promotes health benefits through increases in muscle mass that positively impact insulin responsiveness and glucose control. Exercise recommendations ideally combine RT and ET training to achieve gains in muscle mass, as well as reducing circulating pro-inflammatory cytokines to improve metabolic health.
A summary of research articles studying physical activity and eating behavior suggests that there's a common neurocognitive link found in the prefrontal cortex. Exercise improves blood flow to the brain by increasing brain-derived neurotrophic factor protein activity, feeding the growth of new blood cells and brain cells. If motivation and activity increase in one area, there may be a positive spillover effect. We may experience increased motivation in other areas related to our well-being. This is because exercise increases mood-boosting brain chemicals such as serotonin and endorphins. These upregulating boosts ease pain and increase pleasure while lowering stress-induced cortisol levels.
Numerous studies report that physical activity has a positive and significant health outcome with respect to preventing premature death from metabolic health disorders, as well as some types of cancer. Exercise increases our breathing rate, improving both heart and lung function. This is important because roughly 80% of unwanted body fat is released from the body through our lungs. Losing weight requires unlocking the carbon stored in fat cells, thus reinforcing that often heard refrain of eat less, move more.
Replacing just 1 hour of sedentary time with exercise raises the metabolic rate 7 times above resting rate, removing additional carbon from the body and raising the total released by about 20%. Physical activity also increases levels of adenosine, a type of neurotransmitter that's involved in energy metabolism and expenditure. Levels of adenosine fluctuate, but generally distress, anxiety, and trauma depletes adenosine, whereas cognitive and physical activity result in higher amounts of adenosine by bedtime. This is important because adenosine helps us fall asleep more readily and also experience restorative phases of deep sleep. Physical activity is one of the behavioral pillars of integrated lifestyle medicine. If you're looking for motivation, exercise keeps us looking and feeling younger. We might think we can just eat right and avoid exercise, but it just doesn't work for long-term health and weight management. Similar to planning what we're going to eat each week, we can also plan time for exercise or activities. Important considerations in planning are realistic scheduling, engaging in recommended physical activities that are enjoyable, and having alternatives if the weather or gym hours are inconvenient. Other small habits to increase metabolism include parking further away from work or store entrances, taking the stairs, standing more when we don't need to be sitting, and even performing household chores like laundry, vacuuming, or mowing the yard more frequently. Sometimes it's as simple as this train the brain mantra.
I may not want to, but I'm going to.
Two primary goals for weight management are reducing the health risks associated with metabolic disorders and maintaining a desired long-term body weight. When it comes right down to it, consumption of sugar and unhealthy fats and alcohol are toxic to mitochondria and impair the body's ability to flush or rebuild healthy cells that sustain life and longevity.
Our focus is to take steps that help us restore our metabolic function. First, it's likely we may need to retrain our emotional perceptions of the reward value of certain unhealthy foods and beverages. This starts by challenging impulsive emotional pleasure reward responses with accurate and realistic thoughts. With consistent practice, this can successfully reduce cravings for unhealthy substances and ultra-processed products that lead to overeating.
Supervised weight loss programs often encourage the use of food journals or apps for nutrition and calorie monitoring. These help to build awareness of eating behavior, but they're not without controversy. It's certainly helpful to develop an awareness of what we're actually consuming throughout the day or a week. That said, for some participants, this monitoring feels punitive and can become an unhealthy fixation that leads to the onset of disordered eating, eating disorders, and associated health problems. Our recommendation is to think of dietary suggestions as an opportunity to try new foods, experiment with herbs, try new methods for preparing and cooking food, and enjoy the challenge of being resourceful and adventurous. Genes and mitochondria expression at the cellular level influence mental health, as well as body composition, the drive to eat, and eating behaviors. There is no one gene or cellular dysfunction that activates a particular psychiatric disorder or any other complex psychological trait. In fact, many genes and cells interact to influence the human brain. Normal as well as disordered psychological characteristics are polygenic, meaning that they are shaped by a large number of genes. Cells that are overly excited due to chronic stress or anxiety may cause overactivity in other cells. In the body, this may lead to atrial fibrillation, which increases the risk for a subsequent heart attack. In the brain, this excitability may produce transient ischemic attacks that often precede a stroke. We also see this excitability in the manic phases of bipolar disorder, PTSD, panic disorder, and other conditions marked by mania. Many popular eating styles for weight loss restrict the consumption of carbohydrates, and these are generally referred to as ketogenic diets, KD. There are at least 12 KD eating styles, including plant-based. What they have in common is that after 3 to 4 days, sometimes longer, without carbohydrate intake, the central nervous system will find and use alternative energy sources. For most people, the liver will eventually produce ketone bodies that can be used in place of glucose for energy. However, it takes time for our brain chemistry to adjust to ketosis and for us to feel normal. Once the body adjusts, ketone bodies are efficient energy sources, ghrelin levels increase, and we experience a reduction in appetite. The challenge, however, with KD and most restrictive eating styles is that restricting activates compensatory brain responses that increase the perceived reward value of food as well as preoccupation with food. These responses simply makes us think about and crave foods high in carbohydrates. When clients are unaware of why this is happening, any weight loss due to restrictive dieting may be short-lived. To the point, the brain needs time to adapt to changes with respect to decreasing percentage levels of fat in our body. If a person tries to lose weight too quickly, the brain, in survival mode, may desperately fuel an appetite for glucose in an attempt to have the body return to a previously comfortable BMI composition. One of the concerns with any weight loss regimen, particularly the newer medications that reduce appetite by signaling fullness in the brainstem, is that in a state of starvation, a person may actually be losing equal amounts of fat and muscle. This loss of muscle tissue impairs cellular recovery at the most profound levels and can eventually lead to the onset of sarcopenia. It's strongly recommended that any change in eating styles be supervised by a medical provider to avoid issues with nutrition, cholesterol, fatty liver disease, blood sugar, sodium levels, and more. Guidelines released by the World Health Organization show that there are no long-term health benefits from artificial sweeteners and that these substances may exacerbate Crohn's disease and IBS. Studies of the HPA confirm that artificial sweeteners interfere with our learned control of food intake, appetite, and body weight regulation, energy management. This is significant because of systemic reliance on these products to reduce overall caloric intake. Even if we don't read nutrition labels, if we have an egg and slice of toast for breakfast, our brain knows we consumed 70 calories from the egg and another 100 from the toast. With consumption of unaltered foods like an egg, our brain learns and encodes for future reference what the body can expect in terms of content, energy from certain foods, and regulates our caloric needs and digestive response accordingly. Because the HPA doesn't recognize artificial and chemical additives, it doesn't know what we've actually consumed and assumes we simply need to eat more.
New research further suggests that consumption of erythritol, sugar alcohol, a popular ingredient in sugar-free energy drinks, protein bars, and snack foods, can lead to an increased risk for heart attack and stroke. Erythritol exposure increases oxidative stress in brain blood vessels, increases the risk for blood clots, as well as impairing blood flow.
In the United States, ultra-processed food make up nearly 60% of the calories Americans consume. We often call these junk food, but the term used in research is hyper-palatable. Almost 70% of food consumed in the US meets the ultra-processed hyper-palatable designation. It's important to recognize that these foods are designed to be chemically addictive by companies invested in making profits from substances known to cause addiction. Many of the most popular brands, coincidentally those also highest in added sugar, fat, and chemicals, were designed, produced, and introduced by tobacco industry giants about the same time smoking and the cigarette industry came under attack. There are different levels of processing, some of which are beneficial and reduce the transmission of E. coli and pollutants. Of concern are the ultra-processed foods, which are essentially formulated in such a way that they are pre-digested. They're easily absorbed by the body and engineered to overcome our natural mechanisms that regulate appetite and satiety. Foods that are very high in fat and carbohydrate, in a kind of an equal ratio, don't exist naturally. They're designed by food scientists to look a certain way, feel a certain way in your mouth, and smell a certain way when you open the package. Food products created in this fashion are easily chewed and rapidly digested. They're often formulated with chemicals and flavors designed to appeal to our hedonistic urges. Compared with eating styles that rely on unprocessed fiber-rich foods, we know these urges or cravings can result in compulsive or unrestrained eating, doubling the amount of calories we consume per minute and easily consuming an additional 500 calories a day. One of the keys to mental health recovery and long-term weight management is developing and sticking with simple routines that incorporate new habits in support of long-term lifestyle changes. A healthy lifestyle includes consistent consumption of nutritious foods, physical activity, and sleep. When we add structure to our days, we're more likely to avoid impulsive behaviors that lead to relapse. Those who are successful at maintaining weight loss often eat the same foods, engage in consistent exercise, and don't skip meals. It can be helpful to think about our routines in two broad categories. We all have what scientists categorize as primary and secondary routines. Primary routines are those that are important for keeping us alive and meeting our basic biological needs. Examples of primary routines include sleeping, eating, and personal hygiene. Secondary routines are those that reflect individual preferences and motivations and include hobbies, exercise, work, study, and how leisure and social time is spent. Weight management and maintenance behaviors, of course, span across both primary and our secondary routines. In terms of primary routines, when researchers track the behaviors of people who maintain their weight loss, they find that weekly meal planning and nutrition tracking are the most commonly reported routines. Once established, routines do not require conscious effort or thought and should be structured in a way that reduces the need for decision-making. The brain needs a steady supply of nutrients, including vitamins A. The B suite, D3, E, K, choline, iodine, copper, iron, magnesium, zinc, sulfur, selenium, and more. Before considering supplements, these nutrients are all readily available from foods we eat regularly, especially eggs, animal protein, fish, shellfish, spinach, avocado, and berries. These images show the MRI scans of two healthy, dementia-free people following very different diets. Let's check out the differences between them. To the left, you can see the brain of a 52-year-old woman who's been on a Mediterranean-style diet most of her life. You might not be able to recognize this at first glance, but her brain looks great. In fact, that's a picture of exactly how we want our brain to look when we're 50. First of all, her brain takes up most of the space inside the skull, the white ribbon that surrounds the brain in the figure. The ventricles, those little butterfly-shaped fissures in the middle of the brain, are small and compact. The hippocampus, the memory center of the brain, is well-rounded and in close contact with the surrounding tissues. In comparison, the scan on the right shows the brain of a slightly younger 50-year-old woman who's been eating a Western-style diet for many years. This means fast foods, processed meats, dairy, refined sweets, and sodas. The arrows point to brain atrophy or shrinkage, an indicator of neuronal loss. As the brain loses neurons, the space is replaced by fluids, which show up as black on an MRI. As you can see, there are more black areas present in the brain that has been fed a typical Western diet than in the brain that consumed a Mediterranean diet. The butterfly-shaped ventricles are larger in the brain to the right, which results from the brain shrinking. The hippocampus itself is surrounded by fluid, in black, as is the temporal lobe, another region directly involved in memory formation. These are all signs of accelerated aging and increased risk of future dementia. We spend a significant amount of time in sessions working with this equation developed by Ellis. It's a straightforward and useful technique to help clients recognize the thoughts that keep them stuck and helps identify what they can think or do differently. Actions combined with beliefs produces consequences. These can be positive or negative. It's fair to say that discussions on nutrition and exercise can produce a host of negative feelings and memories of failed attempts. We remind clients that those are old stuff or old beliefs. As they begin work on plans for weekly meal planning and activities, actions, we suggest they write down 3 encouraging thoughts to create new beliefs that support positive health consequences and rewards. Many biological, psychological, and social, also referred to as biopsychosocial, attributes are inherited and influenced by family, racial and cultural, and environment. As mentioned earlier, there is a significant genetic inheritance that contributes to metabolic and psychological development and predicts or determines vulnerability to metabolic disorders and other health problems. We encourage participants to use the family tree on the last page of the chapter to document the health, weight, and mood history of their grandparents and parents. If they heard anecdotes like grandma was always angry or grandpa was an alcoholic, they enter that information as it was told to them. There are 2 open boxes to enter information about other family members such as aunts, uncles, or siblings who may be of relevance to their health. If possible, the goal is to visualize the history and contribution of previous generations and to understand the influences on development as well as potential areas of vulnerability.
Congratulations, you've completed part 2 of session 2. In the next part, we'll explore compulsion and the science of addiction.